Hello and welcome to today's session on infective endocarditis. And in today's session, I'm going to discuss on both acute and subacute aspects of infective endocarditis. And I am going to do a clinical and pathological correlation in this session. And in the next session, we will discuss further on the various aspects of infective endocarditis, the immunological phenomena, and the clinical features, and how to distinguish it from other aspects of endocarditis. So I am Sri Kumar, Professor of Pathology and Director of Research and Postgraduate Studies at Masa University in Malaysia, and I'll be taking you through this session today. Now, historically, infective endocarditis was first described in 1616. This was nearly about 500 years ago, and that was when they found that the heart was being infected when there was a damage in the valve. And later in 1809, it was Burns who first was able to observe vegetations. And vegetations he described as a concretion. Concretion means a swelling or a hard part like a stone, which is larger than a pigeon's egg and contained in a left auricle. So very interesting. Huh? What is the size of a pigeon's egg? About 200 years ago, he described that it's larger than a pigeon's egg. So when you Google a pigeon's egg, you will find that it is anywhere from as small as a few millimeters to as large as a few centimeters in size. So when Burns described as large as a pigeon's egg, larger than a pigeon's egg, he meant that a vegetation could be anywhere from a few millimeters to several centimeters. And it was later Osler, Sir William Osler, who did a comprehensive overview of infective endocarditis, and he has written notes and notes which have later been published in journals and textbooks. And for over 30 years, between 1885 and 1915, he was the authority on infective endocarditis and written so much that one of the clinical features that you see in the fingers, tips of fingers, are Osler's notes named after him. So what we discuss now as infective endocarditis is nothing new. It's been discovered, even and identified and described as early as up to 400 years ago. And later in 1923, Lewis and Grant, two scientists, were the first people to associate bacteremia with deformed valves. And they showed that this is a risk factor for infection. When people have bacteremia of a short duration and they have deformed valves, such as maybe a congenital heart disease, atrial septal defect, a ventricular septal defect, or patent ductus arteriosus, and these people have a chance to develop an infection. And at the same time, the development of penicillin, which happened somewhere in the same period when Lewis and Grant linked bacteremia with deformed valves, that was the time when penicillin was discovered, and that was the first successful therapy for an infection which otherwise did not have any treatment. People were dying due to this. So how do you define an infective endocarditis? As the name suggests, infective and endocarditis. Infective means it is of an infective etiology, microbial factors. Endocarditis is the inner layer of the valve. And the inner layer or inner part of the valve includes the lining and also the valves. And this microbial infection of the valves can be caused by bacteria or fungi or chlamydia. And this can be either acute or subacute. This is based on the onset of symptoms and the rapidity with which clinically the bacterial infection goes on. But alternatively, there are some books that describe this as a form of a risk factor. It could be nosocomial related. When a patient is admitted in the hospital and he gets an infection due to any other hospital related infection, due to prosthetic valves, which I will discuss later in the next session, or due to intravenous drug use associated. Now, intravenous drug users usually use the same syringe. They sit together as a group and they inject a drug using the same syringe and needle because they've already diluted it. So this can actually cause an infection, and it can also cause a thrombus, to form and or bacteremia to form and go and affect the heart valves. So as much as I'm going to discuss the pathological features in detail, the main salient pathology is this structure here. I hope you can see my pointer. Now this is a ventricle that has been cut open and you can see a large irregular structure here. This structure is called a vegetation.